Okay, thank you for this opportunity to present this webinar. And today's presentation is about the challenges of adolescent mental health issues. And if you have any visibility issues, let me know. Uh, okay. So it is about adolescent challenges in adolescent mental health. So first of all, we will just discuss what is mental health and what is mental illness. And definitely we need to distinguish between the mental health and mental illness. Mental health is the successful performance of mental function resulting in the productive activities, fulfilling relationship with other people, and ability to change and to cope with adversity. Okay, if as we all know, if we are able to cope with the adversities, if we are able to adapt with the changes, or if we are able to fulfill a relationship, definitely our mental health is stable. If there is any difficulty, then we will go for any mental health issues. And regarding the mental illness, it is different from mental health actually. Mental disorders are characterized by alterations in thinking, mood, or behavior associated with distress or impaired cognitive functioning. Okay, so let us see. Let us club with today's title, that is Adolescent Mental Health Challenges. So we are going to discuss about what is adolescence and puberty. I know all of you are aware about what is adolescence and what is the age which is described as adolescent age. And in some classifications, puberty is classified into one group, and adolescence is classified into another group. But in some other classifications, both are clubbed together. And for our understanding, puberty is between 10 to from 10 to 12 years to 13 to 14 years, and adolescence is from 13 to 14 to 18 years. So we cannot differentiate it as a watertight compartment. It is a continuation actually. Okay. Any issues?
Slides is not visible now.
Is it visible now? No.
Yes, visible, ma'am.
Visible.
Yes.
Okay. I think when it is slideshow, then it is some issues. Okay. Shall I continue like this?
Yeah.
So this is about puberty, and what do you mean by puberty actually? So puberty is a period of rapid physical maturation occurring primarily in early adolescence that involves hormonal and bodily changes. So this is actually a period between childhood and adolescence. So in this period, rapid physical maturation is going on, and a lot of hormonal and bodily changes are occurring in between. Okay. Uh, some issues. Okay. Hello.
Hello.
Yes. Yes. Is it visible or any issues?
Visible, ma'am. You
Okay,
continue.
someone is talking. I thought, okay, it is towards me. Sorry. Okay, so let us see what are the puberty indicators. For boys, it is the first nocturnal emissions are considered as as the primary indicator of puberty, and for girls, it is menarche, that is the first menstrual cycle. And let us see what are the different effects of puberty changes, especially on the physical well-being of an individual. So definitely fatigue will be there, digestive disturbances will be there, anemic. Then girls, for girls, if they are early, if in the early in the early menstrual period, they might have headache, backache, abdominal pain, vomiting, etc. So you might have think about why I'm describing all these things. As it is a school mental health program, and definitely we need to understand what are the characters, what are the features of these puberty and adolescence. Then only we will be able to handle the situations. So that is why I'm describing all these things, because during the in the school age, definitely, especially in the period of adolescence. Um, Children might have complained that okay, it is they are highly in fatigue state, or they have digestive disturbances. Then then we will think about, okay, this is part of puberty and they need some sort of care and attention. That is what we need to understand. Okay, then the effects on attitude and behavior. And during this puberty changes, there are a lot of attitudinal changes and behavioral changes happens in an individual's life, especially the desire for isolation, boredom. A lot of adolescents will complain that they are getting bored. Then incoordination, social antagonism, heightened emotionality, loss of self-confidence, excessive modesty, and all these are the effects on the attitude and behavior of an adolescent. Now we are moving towards our major area, that is adolescence. And let us see what are the overview of adolescence. Being after puberty, ends with identity establishment, begins after puberty and ends with identity establishment in adulthood. Here we can connect with Erickson's theory also. In Erickson's stages that we will see in the next slide. Then period of physical, emotional, and cognitive change. A lot of physical, emotional, and cognitive changes occurs in this period of adolescence. Then importance for the peer relationships. When we compare the children with, when we compare an individual in childhood and adolescent, definitely in childhood they are more associated with their families than the peer group. Okay, but in adolescent period they are more attached and they are more influenced by the peer groups, that is the same age friends. Then dating, sexuality, all increases in importance. And many of them, many of the adolescents first experience heterosexual intercourse also in this period. And regarding the sexual orientation, a lot of individuals, they identify their sexual orientations also. So, regarding the heterosexual intercourses, in our culture, that there will be slight differences. And I have seen a lot of cases that heterosexual relationships starts during the adolescence, and in that period itself, a lot of girls are getting abused abused during this heterosexual relations also. So, in that way, they might have the first heterosexual intercourse, but it may lead to a lot of traumatic experience for them also. And regarding the adolescence development, the key features are physical development, psychosexual development, sexual behavior, influences, contraceptions and pregnancy, sexually transmitted infections, then hygiene and sex education, sexuality education programs. All these got important in this particular age, that is 12 to 18 years old. Regarding the physical development of adolescence, body matures and establish reproductive ability. And puberty typically begins around 8 to 13 years for girls, and the mean age for the menarche is 12, and for boys it is 9 to 14 years, and the mean age for seminarche is 13 years. That means, as we all know, girls get mature early than boys. And there are a lot of changes in cardiovascular, energy, sexual desire, mood, personality. All these changes are also part of adolescence and it can be an awkward stage for many. Okay. Then regarding the adolescence, female physical development. Female physical development includes developments of breast, pubic hair, rounding of hip and physique in general, then increased level of estrogen, oily skin, fat deposits, sweating, bodily odors, then cognition regarding menarche are going to vary depend on the social reaction. Okay, that is, if the child was, if the adolescent was aware about menarche and menstrual cycle, it is not going to be a trouble for her. But if it is unexpected and the adolescent girl is not prepared properly about the attainment of menarche, lot of lot of issues are going to she has to face a lot of issues. Maybe acceptance issues will be there. Shocking, it might have been shocking. All these issues can happen at the stage. Okay. Then for male physical development, growth spurts, they can grow 5 to 6 inches per year, and increased appetite will be there. Increased testosterone, scrotum darkens, then testis and penis get enlarged, pubic hairs, deepening of voice, adult physique, they'll achieve the adult physique. Frequent and spontaneous erections will be there, and nocturnal emissions are also part of physical development in adolescence. Then we just have a glance at the theoretical background. The major three theories are, one is by Sigmund Freud's psychosexual stages of development, then second one is Erikson's psychosocial stages of development, and third one is Piaget's cognitive development theory. Freud is the first person to do some classifications in the lifespan, and his classification was till the puberty, or from till puberty he classified into different groups, and after that it is considered as a single group. So oral, anal, phallic, latency, and genital periods are the five stages which described by Sigmund Freud. And for us, it is more, we need to give more focus on the genital period, because it is during the puberty period, and the focus is sexual behavior, and focus of conflict is sexual relationship with partners, and immature love, indiscriminate hate, uncontrollable working or inability to work. All these are the difficulties at this stage, and at this stage which may affect the later life. The second theory, that is Erikson's psychosocial stages of development, and actually it is a little bit elaboration of Freud's theory, and Erikson added three more stages to the entire lifespan, and he divided the entire lifespan into 8 stages. And here during the adolescent period, the stage is fifth stage, and it is identity versus identity confusion. That is, in this stage, the child begins to develop an identity, and if it is not properly developed, definitely identity confusion might have occurred. Okay. Then the third theory is Jean Piaget's theory of cognitive development. It is more related to the cognitive development, how the cognitive functions are developed in a child. So he classified this theory into 4 stages, and in the present age of our consideration, that is adolescence, it focuses on formal operational stage, that is age 12 and up. So in this formal operational stage, we can see a lot of questioning behaviors, abstract thinking in these children. So they start asking questions: why this happens? If I'm not doing this, then what is the problem? So likewise, they started questions. Okay, that is about their abstract thinking. Logical reasoning will be there. All such things are developed in the fourth stage, that is formal operational stage, that is age 12 and up. So here, this is the theoretical background on which we need to understand the adolescent period. So in the first theory, it gave more emphasis to sexuality, whereas in the second theory, that is Erickson's psychosocial stages of development. He gave more emphasis to social development, and in cognitive development theory, it is more focusing on the how the cognitive function is properly developing. Okay, so the next, okay, what are the mental health issues or challenges which we need to address during this period, that is adolescence period? Emotionality during adolescence is one thing which we need to we need to consider, because usually the adolescents are they might have show some impulsivity. They may be anger at time, fear. They might have expressed fear, jealousy, curiosity, envy, grief, affection. All these types of emotions, they exhibit all these sort of emotions in its extreme levels. There is no midway actually. They might express it in a it in an extreme manner. Okay, then the social changes during the adolescence. So what are the social changes? They have increased peer group influence, a lot of changes in their social behavior. They in previously in their childhood they are not giving more attention to the social behavior or social changes. So now during the adolescence they began to began to focus on the social behavior. Then they form new social groups also, because they don't have they don't have any access with social groups and all in their childhood, but in adolescence they started new social groupings, then new values in the selection of friends also. If we just think about children and adolescents, you compare about this both this group, you can see that in childhood their friends are in school and all. Their friends, who is their friend? The person who is sitting next to him or her is a close friend of that child. But whereas in the adolescence period, friend selection, the process of selecting friends are getting more complex and different also. So they started getting friends from friends, those who are having similar ideas, those who have similar values, or those who have similar focus. So there are a lot of criteria for selecting friends also. So their friend selections will be based on different criterias, and new patterns will be there in their friend circle also. Then new values and social acceptance. So a lot of social acceptance. So they'll give emphasis to new values for social acceptance also. Then let us see what are the adolescent interests. They are more interested in recreational activities. So the involvement of such activities will be high. Then social interest will start. Then they might have personal interest also, based on their personal ambition and all. Then educational interest, vocational interest, religious interest, and interest in status symbol. So these are the major categories of interests which are exhibited by this adolescents. Okay. Then regarding the interest in appearance, those who are working with adolescent people, definitely they are aware about their interest in appearance. So they will do a lot of activities to focus on their appearance, or to improve their physical appearance. A lot of attention-seeking behaviors will be there as part of their interest in appearance. And so their choices in appearance might include clothing fashions will be there, accessories, use of lot of accessories, then their hairstyles, nail arts, lot of nail polishing patterns are available in these days. Then body art, that is also another new trend among this adolescent group. Then shoe styles, cosmetics, skin tone, etc. These are the major areas they are focusing about the appearance. Okay. Um, Next is interest in independence. So adolescents are they in this period they wish to be an independent individual. They don't want to depend on others for their for their further living or their progress and all. They want to decide to their own decide about their own life. So in all such areas they need independence, so they don't wish to be dependent with others. And regarding the interest in status symbol, so a lot of status symbols are used by this group. Maybe at times vehicles will be one status symbol. A lot of even though they are not mature enough to get a license and all, but they still wish to have a vehicle, especially bikes. Bike, if in the case of bike and all, they are not interested in the in the they are more interested in bikes like Duke and all. So such vehicles, they feel that it is a status symbol for them. Then drinking, okay, if they are consuming alcohol, that itself, some of them consider it as a status symbol. Then smoking, drugs, all these things. Okay, then what about the family relationship during adolescence? Is it a peaceful one, or is it a harmonious one? No, it is not. It is not that much peaceful or has harmonious. Definitely, it is a period of family friction. There will be a lot of clashes between parents and adolescent children. So, uh, clashes between mother, daughters, father, son, all these are very much present, as well as there will be sibling rivalry or clashes with their siblings also present. So, let us see what are the causes or why this family friction occurs. Family frictions, okay, they might have friction because of their standards of behavior, and clashes between their standards of behavior and family members parents standards of behavior, and the methods of discipline which is following in their family, and the relationship with siblings. Okay, if they might have a feeling that parents are giving more emphasis to their sibling, definitely it will leads to family friction. Then feeling victimized always. Usually adolescents are more victimized for the simple or the silly clashes between the siblings. So usually parents will blame on the adolescent to the for such small relationship issues with the siblings. Then hypercritical attitudes. The adolescents are more critical, and their hypercritical attitudes is very difficult to cope with the family's attitude. Then the family size. If it is less number, and if it is more members in the family, definitely the size of the family is also a reason for the friction. But there are cases in which I've seen a lot of cases in which friction between parents and single children. Okay, so the number is, we cannot say that always small size family is good. No, we cannot say like that. But in the case of some big families, also there are a lot of harmonious relationships are also there. So we cannot say that. But how these adolescents are treated in the family, that is very much important. Then a lot of immature behaviors. Adolescent express a lot of immature behaviors which the family members may not be able to tolerate. Then rebellion against relatives. All these things are the reasons behind the family friction. Okay, so let us see what are the major mental health challenges of this period. So this all these things we need to consider in the background of our presentation. Now we are moving towards the major part, that is what are the major mental health challenges, especially in this new era. And especially in the wake of this pandemic, a lot of changes are there in our relationships and all. So let us see what are the major challenges in adolescent mental health. First one is internet addiction. So we know that during this pandemic, children, adolescents, and adults are spending load and loads of time on online and computers. So there is a problem of internet addiction. It is very difficult to keep away our mobile phones or in computers. So that is a major problem in this current scenario. So spending a lot of time online on the computer is defined as an impulse control problem. And when it absorbs too much time and neglecting relationships, works, school, or other important areas of life, then we will call it as internet addiction. Okay, nowadays we are spending a lot of time in front of this internet or mobile phone. Oh, okay, but the issue is that we are spending this much time. So today itself, when you think about the duration of your today's net usage, there is more than hours. So we cannot say for a single with a single day's experience, we cannot say you are an internet addict. No, you are not an internet addict. But you are online because there is certain codes, there is certain purpose for this. But and no, you will be able to handle your work properly. You will be able to do your works, all these things. So it is you cannot say that you are an internet addict. But there are individuals who are not able to say stop or pause to the internet usage. For them, their for them the internet will be absorbing too much of their time, and they have issues in relationship. They are least bothered about the others who are present around him or her. Then it might have affect their work, school, and other important areas of life. And what are the risk factors for internet and computer addiction? So anxiety, depression, then presence of other addictions, then lack of social support, less mobile or socially active, and stress are the major risk factors which promote towards internet addiction. Okay, you can see less mobile and socially active. During this pandemic, we all know that nowadays we cannot move freely. Okay, so during the lockdown period also, we were not able to move freely, and we were not socially active. So all such things, okay, we channelize our energy, or we substitute all those social activity towards this internet and mobile usage. So this is how internet addiction develops. Let us see what are the criteria for internet addiction. Signs and symptoms: losing track of time while online, having trouble completing tasks at work or home, increasing isolation from family and friends, feeling guilty or defensive about internet usage, feeling a sense of euphoria while involved in internet activities. These can be the symptoms or signs for internet addiction. And internet addiction may leads to a lot of physical discomfort also. Carpal tunnel syndrome, that is pain and numbness in hands and wrists because of this movements. Then dry eyes and strained vision, back or neck aches, then severe headache, sleep disturbances, pronounced weight gain or loss. Okay, if you can observe small children, and if they are using more mobile phones in a day, it might lead to sleep disturbances in these children. Okay, so that we can observe from our surroundings. Let us see what are the major categories of internet addiction. It is cyber sex addiction, compulsive use of internet pornography, adult chat rooms, fantasy sex, etc. Then cyber relationship addiction, including addiction to social networking, chat rooms, texting and messaging, net compulsions such as compulsive online gaming, gambling, stock trading, and use of online auction sites, computer addictions, obsessive paying offline computer games, or obsessive computer programming. Then information overload, compulsive web surfing or database searching. I have seen a lot of students and students as well as adults. They are okay whenever they hear a term, they'll surf in the net. Okay, what is that? What is that? What will happen? What are the side effects? A lot of medical searches are also very high in this category. Then another thing is substance abuse. Okay, why these adolescents are going behind this substance abuse? Maybe for relaxation or fun, in order to overcome boredom and then curiosity. So, as part of their curiosity, they might have used certain substances. Then, socializing with friends, peer pressure, or the need to feel part of a group. Okay, if a group of, if their friend circle, they are using certain substances, definitely this person is also start using these type of substances. Then to escape from psychological or physical pain, then experiment for the sake of experimentation. What will happen? So for that purpose, also some adolescents start using substances, and alcohol, nicotine, all these things considered under substances. Then influence of mass media, excessive stimulation. These are the reasons behind the substance abuse. And what are the risk factors? Definitely, biological risk factors will be there. Social environmental risk factors. Then age and stage of development is also a risk factor towards this substance abuse. Genetic, gender, ethnicity, presence of mental disorders, all comes under the biological risk factors. Whereas in social environment, the influences of family, friends, then socio-economic status of the family or friend circle, then quality of life in general, then peer pressure, physical and sexual abuse. Those who are victims of physical and sexual abuse might have go behind this substance abuse. Then stress, quality of parenting, all these can be a risk factor for towards the substance abuse. Then age is also a factor. Especially the adolescents' age, they are more vulnerable towards the addictions. Then drug abuse. Lot of drugs are available nowadays among this for this adolescents group. So the repeated use of these drugs may experience certain euphoric feelings, and that feelings may lead to the addiction or chronic usage. Then it might have affect their brain. So a lot of effects are experienced by abusing these drugs. So what are the effects? And the effects are heightened sensory perception, euphoria, weight loss. They might have lost their weight. They might have an elated feeling, then increased alertness and energy levels, then abilities to sleep. It may affect their ability to sleep also. Then towards the more psychological effects include paranoia, okay, suspicious towards others, then hallucinations, hearing or auditory hallucination or visual hallucinations, then seizures, fits, then memory loss, organ failure, tooth decay, weight gain, cognitive impairment, even death can happen due to the drug abuse. Then alcohol use and abuse. Ethyl or ethanol is an intoxicating ingredient found in beer, wine, and liquor. This is when we consume this, it may affect every organ in the drinker's body, then can damage to developing fetus. If the person is conceived, definitely it can affect the fetus. Then impair brain functions and motor skills, increase risk of certain cancers, then stroke, liver disease, interpersonal relationships, and ability to work. All these can affect. All these are the effects of alcohol use and abuse. Then smoking. It is also increased nowadays in the adolescent group. Lot of adolescents experiments with smoking, cigars, pipe tobacco, snuff, chewing tobacco, all these types of addictive drug called nicotine usage. Okay, so nicotine addiction may lead to long-term brain changes. So the reasons for smoking are peer pressure, social bond with other smokers. They like a risk as risk taking behavior is one characteristic of adolescents. So they are more interested to take risks than parental influence, misinformation, than genetic predisposition, advertising and other media influences, then self medication for stress and all. They started smoking in order to reduce their stress, and in a lot of IT companies and all, there is a particular area for smoking in order to smoke. They can smoke, they can go there and smoke. So, usually people will say that it will relieve stress. So, then oral satisfaction, then keep from overeating or biting nails. So, for such purpose, also, there are people who are smoking. Then another major challenge during the adolescence is the occurrence of eating disorders. So, as we discussed earlier, appearance is a major important factor for this adolescent group. So, eating disorder, the presence of eating disorders is very important. So, eating disorders may be a combination of biological, behavioral, and social factors. An adolescent with an eating disorder is so preoccupied with food and weight that they can often focus on little else. So, 1 in 100 adolescent females and 1 in 1,000 adolescent males suffer from eating disorder. So, fear of becoming overweight or suffer from depression or low self-esteem, feelings of emptiness or feelings of helplessness and out of control. These are the psychological variables which play behind this eating disorders. So let us see what are the major eating disorders. One is anorexia. That is anorexia nervosa. Anorexia nervosa, as shown in this picture, you can see a picture in the slide. That is one girl is observing her figure in the mirror, and she's very slim, but she perceives that she is a very fat one. So this is the major issue. So such a perception is there. What this person will do is they will try to starve themselves so that they need to reduce their weight. So refusal to eat adequate calories out of fear of becoming fat. So they are fear for becoming fat. So in order to avoid such fear, they refuse to eat. So it can damage major organs, cause irregular heartbeat, low blood pressure, pulse, body temperature, breathing rates, cessations of menstrual cycle, infertility, brittle hair and nails, and thinning of bones. These can happen in this anorexic patients. So it is a fatal thing. 1 out of 10 cases death occurs, and it is usually due to cardiac arrest or electrolyte imbalance or due to suicide. So this is a major issue which you can see among the adolescent group. Second is bulimia nervosa. That is gross overeating, binge eating is there. Then purging, that is get rid of the food. That okay, what they will do, they will induce vomiting, so that they'll eat and they'll induce vomiting. Okay, so feeling disgusted and ashamed after overeating, bulimics try to prevent weight gain by inducing vomiting or using laxative diet pills, diuretics, or enemas. So stomach acids from chronic vomiting can cause damage to tooth enamel, inflammations of the esophagus, swelling of salivary glands in the cheeks, and lower blood levels of potassium that can lead to dangerous abnormal heart rhythms. A lot of famous personal celebrities also have these two conditions, that is anorexia as well as bulimia. So, and the third thing is binge eating disorder. It is a condition in which person may go rapidly on food but does not purge. They won't induce vomiting. They'll have food uh, and the excess weight caused by binge eating puts off individual risk for heart disease, high blood pressure, high cholesterol, and type 2 diabetes. So this is a major cause for the lifestyle diseases. Then another one is adolescent obesity. Obesity in adolescents can be attributed to poor eating habits, fast food diets, overeating or binge, then lack of exercise, family history of obesity, medical illness, medications, stressful life events, family and peer problems, then low self-esteem, emotional problems and depressions. And overweight and obese adolescents are targets for bullying also. So that is another issue they are facing due to this obesity. And one third of adolescents are overweight or obese. So that is also another issue which we can see in our day-to-day dealings with this adolescents. Adolescents who are obese are likely to be to be obese as adults and are therefore more at risk for adult health problems such as heart disease, type 2 diabetes, stroke, several types of cancer, and osteoarthritis. Then another major mental health challenges committing this self injuries. It is not suicide attempt. Self injury is an unhealthy way to deal emotional pain and intense anger or frustration. So what they will do, they'll do some injury towards their own body. So it is a secretive behavior, easily hidden under clothes. Then it tends to start around the age 14, that is adolescence period. There is a higher incidence in females than males, and a lot of self-injurious behaviors are seen in girls than males. Then, because self-injury is often done impulsively, self-injury may be linked to a variety of mental disorders such as depression, eating disorders, borderline personality disorder, and all these types of mental disorders are associated with self-injurious behavior. So, through this self injury, what the person tried to do is they try to manage or reduce their severe distress or anxiety and provide a sense of relief, then provide a distraction from painful emotions through physical pain, feel a sense of control over his or her body, feelings and life situations, then feel anything, even physical pain, when feeling emotionally empty, express internal feelings in an external way. They might have expressed their internal feelings in this way. Then communicate depression or distressful feelings to the outside world. Maybe it is an indication towards the world. Then be punished for perceived faults. What are the different types or different forms of self-injury which you can see through this? See, when you interact with adolescents, cutting usually on arms, legs, then craving words, symbols on skin, then breaking bones, hitting or punching, creasing the skin with sharp objects, head banging, biting, then pulling out hair, persistently picking or at or interfering with wound healing, then burning, that is, they lit matches, cigarettes, or hot sharp objects like knives at all. Then another major challenge in the mental health of adolescents are depression. It is a persistent feeling of sadness and loss of interest in activities. It affects how the adolescent thinks, feel, and behaves, and it can cause emotional, functional, and physical problems. As in the adult depression, there are slight differences in in the depression among children and adolescents. So they if they express irritability and all, we might have doubt for this depression, and definitely they need help they need professional help also. So, what are the causes of depression? A lot of causes are there. Chemical imbalances in brain, hormone, inherited traits. All this comes under the biological causes. Then early childhood trauma, learned patterns of negative thinkings are also causes for depression. Then having an anxiety or eating disorder, few friends or
Excuse me,
yes,
sorry for the interruption. Actually, madam, you have only 5 minutes remaining.
yes, it is
Thank
about to
you.
finish.
Okay, okay. Thank you. Thank you.
Then depression. Okay, I'll just move towards the next depression. Then, what are the symptoms of depression? That part you need in your day-to-day life, because agitation, restlessness, use of alcohols or drug, then exaggerated self-blame, self-criticism, poor school performance or attendance, tiredness, loss of energy, insomnia, sleeping too much, then feelings of sadness, crying spells for no apparent reasons, then irritability, frustration, or feelings of anger over small matters, then loss of interest or pleasure in normal activities, family, friends, then feelings of worthlessness, guilt, fixation in past failures, trouble with memory, thinking, concentration, decision making, then frequent thoughts of death, dying, suicide, or grim features, then changes in appetite, dramatic weight loss or gain, frequent complaints of unexplained body aches, headaches, neglected appearance, disruptive or risky behavior, self-injury such as we discussed earlier, self-injury such as cutting, burning, excessive praising or tattooing, all are symptoms of, all can be considered as symptoms of depression. And after the depression, definitely the another major challenge is suicide. Suicide is one of the topmost cause of death among adolescents. There are two major leading causes of death. One is suicide and the other one is accidents. So suicide, teen suicides are increasing, maybe due to certain psychiatric disorders like depression. Then if there is a history of family history of suicide, or family history of mood disorder, family history of mental illness, all can lead to increased risk for suicide. And how can we what are the risk factors, access to the means, okay, the ways to commit suicide, then use of alcohol, drug, becoming pregnant, social isolation, exposure to suicide, loss or conflict with close friends or family members, all can be risk for committing suicide. Then, what are the warning signs of suicide? Definitely, before committing suicide, a lot of signs will be there. So they'll talk about or hinting at suicide, talking about or writing about death, that is suicide notes will be there. Increased use of alcohol or drugs, feeling purposeless or hopeless, withdrawing from social contact, mood swings, changes in normal routine, including eating and sleeping pattern, acting recklessly or aggressively, then giving away belongings or getting affairs in order when there is no other logical explanation or why this is being done, developing personality changes or being severely anxious or agitated, or unexplained cuts or burns caused by self-injury, can all these can be warning signs for suicide. So we need to be very much aware about these signs and symptoms. Then only we will be able to identify whether there is any suicidal ideations or indications in this particular adolescent. Then adolescent accidents, a lot of accidents can happen because of their adventurous behavior or their experiments with fire, falls, poisoning. So a lot of even you can remember a lot of death occurred while taking selfies in a dangerous or adventurous manner. So adolescent accidents are also a major cause of death among the adolescents. Then auto accidents. So as I have already mentioned that they are more curious, and they are more interested towards adventurous driving and all, even though they don't have a license for driving and all. But a lot of accidents they create and a lot of death happens due to adolescent auto accidents. And okay, so these are about the adolescent auto accidents and all. Then bullying, that I forgot earlier. So bullying is another issue. Usually adolescents are more involved in bullying, physical bullying, verbal bullying, emotional bullying, and electronic and cyber bullying are the different categories of bullying. And teenagers may affect this bullying. A lot of emotional, verbal, or cyber bullying can affect the teens, leading to depression, suicide, drug usage, and isolation, and long-term stunned social development also. So these are the major issues which are very much prominent in the current scenario. And so I'm finishing my presentation by this, and if you have any queries, you can ask questions.